Hi guys, hope everything is going well for you. Hopefully you're getting used to everything being remote. I hope everything is going well with other areas of your life, and hopefully we'll see that things will slowly come back to normal over the next couple months probably, hopefully. So we are going to be talking about chapter 13, which is diabetes. And it's not a super long chapter, but it does have a lot of very important information in it because either yourself or a grandparent or a parent at probably one point in their life or your life is going to be diagnosed with type 2 diabetes, type 1 being a little less common, but it's important to know this information and to know what can be done in order to kind of prevent or mitigate the onset of diabetes. So diabetes is a common disease that is characterized by elevated blood glucose. So normally after you eat, some of the food is broken down into glucose, which is a sugar, and is transported through the body in the bloodstream. And then the rise in the blood glucose triggers the pancreas to release insulin. The insulin is then going to be responsible for transporting the glucose into body cells where it can be used or stored as energy for later use. In general, diabetes results from the body's inability to produce insulin. This is referred to type 1, or to the use or to use the insulin properly to lower blood glucose levels to normal, and this would be type 2 diabetes. Approximately 90% of people with diabetes have type 2. The origin of type 1 diabetes differs from that of type 2. So type 1 is an autoimmune disease, and that occurs when your body attacks its own cells. In type 1, the cells in the pancreas that produce insulin are destroyed. Therefore, since there is not insulin present to transport the blood glucose to working tissues, glucose levels remain high. A high level of glucose in the blood is called hyperglycemia, and that's something that we've talked about in class. Since insulin production is deficient in type 1 diabetes, this disease must be treated with insulin given as injections, which can be delivered via an insulin pump or sometimes inhaled. Type 2 diabetes occurs when body cells cannot properly use the insulin produced by the pancreas. So the pancreas can still produce it, usually early on especially, but the body cells aren't able to actually use it. This is called insulin resistance. Essentially, the body cells are resistant to the action of the insulin. Due to an insulin resistance, the glucose cannot enter the cells, and thus it remains in the blood. Because those individuals with type 2 diabetes use their ability to produce insulin over time, they must supplement with insulin to control blood glucose. Obesity is another disease associated with development of type 2 diabetes, in particular upper body fat stores, which we also know as an android body shape. The increased incidence of obesity and sedentary lifestyles has resulted in type 2 diabetes no longer being diagnosed at only older ages, and instead it's developing at younger ages. There are other factors in addition to excessive body weight and inactivity that increase the chances of developing diabetes. These include prediabetes, being older than 45, having a family history of diabetes, and other related health concerns including low HDL, which is the high density lipoprotein, high triglycerides, and high blood pressure, certain racial and ethnic groups, and women who had gestational diabetes or have had a baby weighing 9 pounds or more at birth. Focusing on nutrition is important for all with diabetes, but perhaps even more so with type 2. Weight loss may be a useful goal for people with type 2 diabetes who are overweight, and preventing excessive weight gain if you have type 1 diabetes can help your insulin action to be high and your insulin needs to be lower. Losing 5 to 7% of body weight can lead to a decrease in insulin resistance and improvement in blood glucose control, therefore allowing for a reduction in the amount of medication taken. Those with diabetes should aim to ingest carbohydrates that also contain fiber. Dietary fiber is found in plant-based foods. It cannot be digested completely because it actually resists acids and other digestive enzymes. Thus, there's actually no added calories with it. Fiber also adds bulk and helps move food waste out of the body very quickly, helps you to feel full, and can support weight loss efforts. It may also reduce blood glucose and cholesterol while slowing the ingestion of carbohydrates, slowing the digestion of carbohydrates to glucose. And it is also shown to reduce the risk of heart disease by trapping fat and cholesterol during the digestive process and then actually eliminating cholesterol through stools. While many might think that those with diabetes should avoid ingestion of carbohydrates, the body actually needs fiber that is found in carbohydrate-based plant foods. Carbohydrates are also the body's first choice of fuels during many physical activities. Many with diabetes count the grams of carbohydrate in foods to help control their blood glucose levels. There are three main forms of carbohydrates. It's going to be starches, sugars, and fiber. Starches and obviously sugars have the greatest influence on glucose levels. It is recommended to eat about 45 to 60 grams of carbohydrate per meal. This is including starches and sugars and excluding fiber and non-starchy vegetables. Considering this, diabetics should fill their plates up with the latter, leaving little room for the former. So filling up with those dark green, those non-starchy veggies first, and then kind of completing their plate with whatever might be a starch or have sugars or added sugars. As you review food labels for the number of carbohydrates in a given product, you may run across sugar-free products that contain sugar alcohols, which are reduced calorie sweeteners, usually about half the number of calories of sugar. The blood glucose response to different products may vary, but in general, sugar alcohols have less of an impact on your blood glucose level than other carbohydrates. For example, if a product has a total of 15 grams of carbohydrates and 6 grams of sugar alcohols, you may then subtract half the grams of sugar alcohol from the total amount of carbohydrate. So 6 times 0.5 or half would give us 3 grams of sugar alcohol, which could then be subtracted from the total 15 grams of carbohydrates. This gives us a new total carb or net carb of 12 grams. This is also similar for those products with fiber. So as shown in this image, you'll see that fiber is subtracted from the total carbohydrate. Thus, the new net carbohydrate is only 5 grams. Exercise can not only improve blood glucose levels and glycated hemoglobin, or HbA1c levels, but also reduce blood pressure and cholesterol levels and decrease the risk of heart disease, promoting weight loss and improved brain function, as well as enhanced self-image. Exercise needs to be continued to be effective. Once it is suspended, the physiological benefits related to the control of blood glucose are lost within days. Type 1 diabetes requires that blood glucose levels be fairly well controlled before exercise. When glucose levels are poorly controlled, the liver's production of glucose actually increases, which can result in higher blood glucose levels during exercise. Higher blood glucose levels can also occur transiently after very intense exercise, such as sprinting or heavy resistance training. When blood glucose levels are controlled, moderate intensity exercise can reduce blood glucose by increasing blood flow to the muscle cells, which also increase the rate of glucose absorption into the cells. I mentioned just a minute ago the term glycated hemoglobin, or HbA1c. Hemoglobin is a protein found inside red blood cells that carries oxygen around the body. When blood glucose levels are high, hemoglobin links with glucose that enters the red blood cells. This is glycated hemoglobin, HbA1c, or more simply referred to as A1c. The higher the glucose levels in the blood are, the higher the glucose levels in the blood, the greater the A1c percentage is. Since red blood cells have a limited lifespan, looking at A1c levels can give a picture of the average glucose control over 2 to 3 months. The A1C for someone without diabetes is usually around 4 to 6%, but in those with diabetes, it can be elevated to the upwards of 10% or higher if glucose levels are out of control. Generally, well-controlled glucose is evident by an A1C of less than 7%. Exercise is particularly important to improving A1C levels. For every 1% point drop in A1C, you can actually reduce the microvascular complications that affect the eyes, kidneys, and nerves by about 40%. But looking a little bit more into physical activity and type 2 diabetes, we see that being active significantly improves insulin action and decreases the amount of insulin needed for the body to lower glucose levels. So weight loss can also decrease abdominal fat, which can further improve insulin action and overall blood glucose levels. Exercise has also been known to help prevent the onset of diabetes. And in the diabetes prevention program, people who had high probability of developing diabetes reduced their risk by 58% as a result of lifestyle interventions that included daily exercises, changes in diet, and an average weight loss of 12 pounds. In general, medical clearance is recommended if you have any signs or symptoms of disease, if you haven't been regularly active, even if you have no signs or symptoms, or if you are desiring to increase your current exercise program from moderate to vigorous intensity. If a person has pre-existing microvascular complications, so microvascular is actually referring to small blood vessels, of the eyes, kidneys, or nerves, or macrovascular disease, which is disease of the large blood vessels, such as those of the heart, you should not start a vigorous exercise program without being cleared by a healthcare professional first. A physician may want to conduct a cardiac stress test before exercise, particularly if the person is planning to do vigorous activity, is over 40 years old, has had diabetes for greater than 10 years, has heart disease or strong family history of, and also high cholesterol, has peripheral vascular disease, kidney, heart, or blood vessel disease, or nervous system disease, has not been consistently controlled or has not had consistently controlled blood glucose levels, and is also experiencing joint pain, arthritis, or other chronic health problems. Some medical conditions related to diabetes may also influence exercise choices, including diabetic retinopathy, peripheral neuropathy, and nephropathy. Diabetic retinopathy is a disease affecting the retina, or the light-sensing portion in the back of the eye. While mild background retinopathy will not affect exercise choices, if a person does have moderate non-proliferative retinopathy, or also known, these are microaneurysms, which are microscopic blood-filled bulges in the artery walls, he or she will need to avoid exercises that unduly affect blood pressure. Peripheral neuropathy is a nerve condition that alters the sensation of the hands and the feet, as well as proprioception, or the ability to sense where the body is in space. And falls are going to be more common with this condition, as are joint and soft tissue injuries. Diabetes may also cause nephropathy or kidney damage. So when our bodies digest the protein we need, the process creates waste products. In the kidneys, millions of tiny blood vessels called capillaries with even tinier holes in them actually act as filters. So as blood flows through the blood vessels, small molecules such as waste products squeeze through these holes. The waste products become part of urine, and useful substances such as protein and red blood cells are too big to pass through the holes in the filter and stay in the blood. Diabetes can actually damage this system. High levels of blood sugar make the kidneys filter too much blood. All of this extra work is hard on the filters. After many years, they start to leak and useful protein is lost in the urine. This is referred to as microalbuminuria. Kidney damage can be exacerbated by strenuous activity because of the sudden increases in blood pressure, leading to further damage to kidney function. Although avoiding hypoglycemia is the goal, at times a person's blood glucose levels may drop. it is important that they always have some form of easily absorbed glucose with them. If they are very low, shoot for glucose tablets, hard candy, soda, or juice in order to immediately get them back up. Since fat and proteins slow down the movement of glucose from the intestine to the blood, other snacks such as peanut butter and crackers or granola bars are better to use once the glucose levels have risen or to prevent a later drop. To avoid overshooting and becoming hyperglycemic, a general recommendation is to consume 15 to 20 grams of carbohydrate and then wait 15 minutes to see how much the blood glucose levels rise. If levels are still low, repeat the process. Keeping blood glucose between 100 and 250 milligrams per deciliter optimizes safety by helping to avoid both hypoglycemia and hyperglycemia. When a diabetic eats and when they eat are really important for managing glucose levels during exercise. As mentioned, exercise itself is going to help improve and move glucose from the blood into the working muscles, but this also opens the possibility of blood glucose dropping too low or hypoglycemia. Symptoms of hypoglycemia are shakiness, weakness, abnormal sweating, nervousness, anxiety, tingling of the mouth or fingers, hunger, headache, visual disturbances, mental dullness, confusion, amnesia, seizures, and coma. And I'm sure you have experienced some of these at some point in your life when your blood glucose level has dropped too far as well. If a person takes insulin or is on medication that stimulates insulin release, they should check their glucose levels prior to exercise. If their blood glucose level is low before an exercise bout, so this would be less than 100 milligrams per deciliter, they may need to consume some carbohydrate to avoid hypoglycemia during exercise, especially if they use insulin. But this really does depend on how they are managing insulin doses and timing and the type of activity they do. Depending on the duration and intensity of the exercise session, they may need to take in additional carbohydrate and other food before, during, and after exercise to prevent hypoglycemia. Additionally, a person should be on the lookout for delayed onset hypoglycemia, which typically occurs between 6 and 15 hours after exercise. This is thought to be a result of the liver and the muscles replenishing their glucose stores after exercise. On the opposite end of the spectrum is hyperglycemia or high blood glucose. With type 1 diabetes, this is going to be greater than 250 to 300 milligrams per deciliter. A person may need to postpone or at least decrease the intensity of the exercise session. This decision should also be based on whether or not there are ketones present in the urine. If blood glucose levels are low, the body will begin to break down and utilize fat as a fuel source. Ketones are a byproduct of fat breakdown and make the blood more acidic, potentially causing ketoacidosis, a condition that, if ignored, can cause coma or death. In general, a person should use the decision-making flowchart provided when making decisions regarding exercise. So, for example, if a person checks their blood glucose prior to exercise and blood glucose is between 251 to 300 milligrams per deciliter with no ketones in the urine and they feel fine, then it's okay to exercise. However, we start to see differences if there are ketones present in the urine. And also, if there are no ketones present in the urine and the person feels fine, but their blood glucose is greater than 300, it's going to be okay. They're going to need to proceed with caution and probably stay away from that high intensity exercise because that's going to cause an even greater increase in their blood glucose after exercise is complete. Let's take a look at the physical activity prescription for those with diabetes. Aerobic exercise can help to improve the efficiency of the cardiovascular system and can be beneficial for regulating blood glucose levels. For people with type 1, daily physical activity helps maintain the balance between insulin doses and food consumed. For those with type 2, the focus is really on burning calories and weight management, but also improving overall fitness levels is also important for long-term health. The table offers recommendations for those with both type 1 and type 2 diabetes. If a person is just starting out, it is important to begin gradually because the body needs to adapt to the exercise and also to monitor how blood glucose levels are affected. And really the difference that you're going to see between these two recommendations is we're assuming that some individuals who have type 2 diabetes are also overweight or obese and have not really been engaged in physical activity. And so the approach here is that we need to start very slowly and probably start at low intensity levels. We're shooting for at least 150 minutes per week of moderate to vigorous if we can build up to that. But the recommendation for an individual type 1 who may already be very active is at least 150 minutes per week, or 75 minutes of the vigorous activity, or a combination of both exercises. They're very similar, but again, with type 2, there might be this assumption that the individual is overweight or has been living a sedentary lifestyle, so the approach might need to be a little less strenuous to begin with. Resistance training can lower A1C levels due to increased glucose uptake and increases in muscle mass, so thus we're going to have more working tissue. Precautions do need to be taken, especially for those with microvascular disease because of damage to the eyes, kidneys, and joints. Increased straining while lifting weights can lead to an increased risk of bleeding and retinal detachment for those with proliferative and severe non-proliferative eye disease. Also, be careful if a person has nerve involvement, thus being more susceptible to foot ulcers and bone damage. Moreover, if a person has nephropathy related to diabetes, as strenuous activity can increase protein excretion. The goal of resistance training is to focus on exercises involving the major muscle groups, including the legs, back, chest, arms, shoulders, thighs, and abdominal areas. Flexibility is also an integral part of the exercise program, and typically we want to focus on static stretching, especially after exercise is complete. So we're still shooting for the 2 to 3 days per week, stretch to a point of mild tightness. So you're going to see that this is the same for individuals without diabetes as well. Most of these prescriptions are going to be the same. It's just we have to focus on what is the blood glucose level, how is it changing with exercise, and how do they need to dose, how do they need to respond physiologically to make sure that they don't experience a transient sudden drop or an increase over time because of the replenishing that might occur. Having diabetes can accelerate the loss of balance and increase a person's risk of falling. So balance training can be as simple as practicing standing on one leg at a time, like what we did with our neuromotor lab. It is important to note that resistance training also works the lower body and core muscles, which improve balance while standing and walking. And additionally, flexibility is going to work the full range of motion around the joints, which also improves balance. So important again, especially if a person is dealing with neuropathy. If they have a loss of feeling in their feet, they might have a harder time understanding differences, how the ground is changing, if it's level. And so then their reaction or their proprioception to where their body is at in space is going to be affected. So it is important for them to engage in neuromotor exercise to try to decrease the risk of falling. Diabetes can be controlled with the appropriate use of medications, including oral and injected medications for type 2 diabetes, as well as insulin injections for type 1 mainly, but also for some type 2. In type 2 diabetes, insulin or a combination of insulin and other diabetes medications is used to better control glucose levels. Several classes of medications are used to treat type 2 diabetes as provided in the table. As with the medications, there are side effects as well as situations in which certain medications may not be appropriate. So 2 classes of diabetes medications to watch very closely are the sulfonylureas and the meglitinides, both of which can cause hypoglycemia. And you don't need to memorize these at all. It's just understand that's kind of like other medications. You know, there's different side effects, and they're going to have different effects depending on the individual, and also depending on how well the individual is trying to manage their diabetes to begin with. Insulin can be injected, but it can also be consumed. It can't be consumed orally, but it can be inhaled. And your book talks about how it's only for people with type 2 diabetes. This isn't actually true. Individuals with both type 1 and type 2 diabetes can inhale insulin, and oftentimes you'll see that they have different dosage, different action if they are using their pump. So they might use their pump for a certain amount of insulin or a certain type of insulin that has maybe a long action, and then they might inhale some insulin to offset glucose levels when they eat snacks or just something that has a short action. So both type 1 and type 2 diabetics can inhale insulin. So insulin to be taken to provide background levels is called basal insulin. So just think of that term basal metabolic rate. You know, that's your rate of metabolism at rest and just throughout the entire day. It's kind of the same thing with basal insulin. It's just going to provide kind of that ongoing, trying to control the ongoing levels throughout the day. It's that background work that's occurring. And what a person uses to cover meals or snacks is bolus insulin. So the example that I just provided to you about using the pump, that would maybe be used to provide you or a diabetic with their basal dosage, whereas using the inhaler for insulin might be used to give them that bolus insulin. One other option for delivering the insulin is to use the insulin pump, which is programmed to deliver both basal and bolus dosages. Keep in mind, a lot of insurance companies may not cover either the pump or the inhaler. They might only cover one. The pump can be attached directly to the body via a tube in which delivers insulin throughout the day. And this is nice because before the pump, diabetics had to give themselves shots several times a day. And so this is already something where they're not having to give the shot because it's already inserted. And so they just have to they obviously have to change it every now and then, but they're not having to poke themselves multiple times a day. The amount of insulin dose is dependent on the food eaten, when it was eaten, and if the exercise is to be performed. So if activity occurs within 2 hours of eating, pre-meal insulin should be decreased 5 to 30%, and this depends on how intense the exercise is going to be. Intermediate acting insulin has longer onset action as well as a longer duration. And unless a person is engaged in prolonged exercise, intermediate acting insulin doesn't really need to be adjusted. Long-acting basal insulin does not have much of a peak. Rather, it provides that low constant level of insulin for 24 hours or longer. Exercise is not recommended during peak insulin times unless doses are lowered before exercise or a person eats extra carbohydrates to compensate. The combination of high levels of insulin and glucose-lowering effective exercise can lead to hypoglycemia unless adjustments are made. So maybe just be familiar with the fact that there are different insulin types: rapid-acting, short-acting, intermediate, long, and ultra-long. And just understand how they might affect glucose levels and appropriate times in which you would want to dose with one or the other. The last slide here is actually a link to a YouTube video, or you can actually just go on and look it up on YouTube. It's called Is Sugar Toxic? And it's a 60-minute investigates video that was created, and it's just I think it's a good little video. It's not very long. I think about 12 to 15 minutes, and it's also going to look at some of the research that's being done. And actually this research was conducted quite a few years ago now, and so I just look at it and kind of be familiar with some of that research. Other than that, this wraps up chapter 13, so I hope you have a great day, and please let me know if you have any questions. Thank you.